The National Population Commission (NPC) has promised to provide accurate data for governments at all levels in order to improve maternal and child health in the country. The Federal Commissioner representing Delta State at the NPC Abuja, Honorable Blessing Brume Ataguba, made this known at the flagging off ceremony of the Verbal and Social Autopsy Study (VASA) in Asaba. Honorable Brume Ataguba explained that the program was to collect vital data to facilitate government policies and interventions at all levels to reduce child and maternal mortality in the nation.
Let me state here that verbal autopsy and social autopsy study, which is expected to generate data on under 5 and maternal mortality, is very important to Delta State because the President, Commander-in-Chief of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, GCFR, is implementing programs that will reduce both child and maternal mortality in all states, the states of Nigeria. Therefore, the data generated from the study will help monitor and evaluate the progress of such programs.
She emphasized that the 2024 VASA study was a follow-up to the Nigeria Demographic and Health Survey aimed at investigating the underlying causes and contributing factors responsible for deaths among children between the ages of 0 and 5 and women of reproductive age. Honorable Brume Ataguba noted that the verbal and social autopsy expected to generate data of under 5 children and maternal mortality was vital as it would help reduce the mortality rates nationwide. The Federal Commissioner sued for support for the success of the program. The State Director of the NPC, Mr. Clement Onaro, said officials had been trained to effectively carry out the study in the selected local government areas. Mr. Onaro urged Deltans to cooperate with officials of the NPC during the VASA exercise as the outcome would enable government plan better for their welfare.
And this study is a follow-up to what we call NDHS. NDHS stands for Nigeria Demographic and Health Survey. This survey was conducted 2023-2024. So VASA is a follow-up to authenticate and re-emphasize the data collected through the Nigerian Demographic and Health Survey.
A top management staff of the NPC, Mr. Sylvester Evarere, and the state coordinator of the VASA, Mrs. Ekele Osheye Akideno, said 22 local governments had been selected for the study, noting that 8 had been visited by the team. They said the study would be carried out in states and local government areas with high mortality rates and sued for adequate publicity.
So it's aimed at helping the government to provide solutions to maternal death, maternal mortality in the country, and where we have high rates of such issues, then we can advise the government, because as we know that no country plans for its data, for its citizens without proper data. So we, in the health, in collaboration with the Ministry of Health, Federal Ministry of Health, we are doing this survey to generate data to help governments formulate policies.
The event featured an interactive session.
The verbal and social autopsy study has been introduced by the National Population Commission to check the alarming rate at which children and mothers are dying in the country. In order to address this, they are calling on Deltans to make themselves available for the study. From the State Secretariat Headquarters of the National Population Commission in Delta State, Caroline Ubini.